Hey guys, and welcome back to XL Medical Spa. Today we're going to do something a little bit different. I know I always talk about procedures. I talk a lot about PDO Threads because that's really what you guys want to listen to. But the other thing I always talk about is when people go to different providers, when people hear how different providers do different things. And I've always said there's really no wrong way to do a procedure. One provider maybe use a needle, one provider may use a cannula, left-handed, right-handed, they do it standing on their head. There's really no wrong way to do it. So what I want to do today is actually present a video of one of the people I look up to in this industry. His name is Dr. Rajani. He's up in the Pacific Northwest. Even before I got into aesthetics, I knew about him and I always watched his videos because I was always in the field of medicine. I highly respect him and I like the things that he does. Doesn't mean that I always agree with the way he does something. And probably he's never met me, but probably if he saw my video, he was like, man, what the hell is that guy doing? So I want to react to a video of the cat eye lift, a very popular procedure down here in Southern California. You hear very, very good things about it. You hear very, very bad things about it. And when you guys come see me at the clinic, I have this very long-winded conversation about what you're actually trying to achieve when you're calling it the cat eye, the fox eye, and can you actually achieve it based on your anatomy, your age, and is really the look that you're going for. So let's dive into a reaction video of Dr. Rajani. So I think right here, he's just gonna do his opener. So let's listen to his opener. And I like how honest he is. So let's listen to it.
Hi, I'm Dr. Johnny. Thanks for joining me today. We're gonna dive into my clinic and we're gonna watch a cat eye, fox eye, barbed brow lift. It's very popular. You could be in there all day doing them. People love them. They last variable amounts of times, anywhere from several months to a couple of years. Everyone's a little different. It's part of people's maintenance also now because the brow lowers over time. It's also why you get that horizontal line in the frown here that's not so easy because the whole complex is lowering. So the more we do to prevent, maintain, and give lift, and for the younger generation, they want the flare. It's an in trend, the Bella Hadid brow lift.
He mentions the dropping of the medial brow. He talks about the aging process. He talks about it's a trend. He talks about its maintenance. So it's never a one and done procedure. It's not everyone qualifies for it. Is it what else is going on in that general area of anatomy to get the cat eye look, and can we achieve it? So I love this part about the video. It's his introduction and he says, this is an open conversation. This is him just in his practice with his friend, with his patient, with his client. And they're just having banter, and he wants us to leave a comment, good, bad, whatnot. He knows his procedure might not be the best way. My procedure might not be the best way. Let's listen to him talk.
Of us just having a great day in the clinic like we always do. So we'll dive into the video. Let me know your comments, positive and negative. Never hurts my feeling. We always learn from the negative and from the positive. So
I love that. We learn from the negatives. We also learn from the positives. Whenever I do a training, I always tell them, no matter what I say, stop me. If I do something that you don't agree with or you've seen it another way, explain it to me. Maybe the way you've seen someone else do it, I've never seen it before. So let me know during a training session why I'm doing it this way, why you may be doing it this way, and who knows, I might end up taking your way of doing it and learning something from you. All right, so this is part of the reason why I love watching Dr. Rajani so much. He's just so honest, so open, and I love that he's willing to take feedback and criticism. So let's dive into the video now. Let's just watch how he does a procedure. And let's see if it's pretty close to how I do it.
okay, so we're going to cleanse the area, Abby. And then this is a little bit of lidocaine with epi. So just to help with the opening, and we'll make the opening right here, a little poke coming here. And then a little burn sometimes. And do you feel anything sharp here?
Just a little bit.
Okay, we'll make a little opening right here.
Probably what you haven't seen in this video, he probably jumped right to it. He's just showing the procedure, is I consult first. So when I consult for the brow lift or anywhere else, I'm discussing with the patient and I'm using my finger. Where are you trying to lift and what look are you trying to achieve? So before we even dive into the actual procedure itself, it's very, very important that I understand what this patient is trying to achieve. All right, so let's watch Dr. Rajani actually start the procedure here.
Lift. And so I'm gonna put this in. So we'll start here, and this is my traction hand, and you let me know how you're doing it, and I can give you a little anesthetic whenever you want. I think the first one, let's go straight up. You want a tail. You want a tail lift mainly. Okay, so let's.
So I skip forward a little bit. I do this one of two ways to make it as comfortable as possible. So what you're seeing here is he has the thread preloaded onto a syringe with a little bit of anesthetic. Most likely is bicarbonate lidocaine. I give the patients a choice. I say, if I put a whole bunch of lidocaine throughout your forehead, you're gonna be pretty puffy, pretty swollen, and then you're gonna feel like you're wearing a helmet for the next hour or so. It just gets very, very heavy. So if the client says, nope, I don't care about the heavy feeling, I don't want to feel any pain, then I'll usually numb the tracks ahead of time so they don't feel anything. If they say, yeah, let me give it a go, so I'll put in one thread. If they don't like that feeling, at that point, I'll numb the area.
Up here, now you feel, you have good skin. We've been doing our work. You can feel a little bit of popping through here. You tell me if you have any discomfort. What I'm doing down here is I'm giving a little bit of lidocaine, and that will help create a little bit of an opening till I get running with the thread. And here I am here. Traction hand is my thumb, and I'm going to advance a little tiny bit of light. We don't want to flood the area, because even though these barb 5s have a double cut and they really hold well, it's nice not to have too much. And I just gently move it through. There's no need to be aggressive. We have all the time in the world.
I love that. Don't be aggressive. When I do my trainings, people are diving and digging and trying to find the tract. The body and the anatomy will always dictate if you're in the right place. One, listen to the patient, and two, listen and feel where you're at. So if the patient is squinting or in pain, likely I know I'm in the wrong place. And then also I probably need to give a little more lidocaine. If I'm too aggressive, I don't give the opportunity to know where I'm going, and also I don't give the opportunity to the patient to vocalize if I'm in the wrong place. So I love that. Very, very slow, very, very easy.
How are you doing with that?
That's good.
A little spicy?
No, I don't really feel that much.
Okay. So I'm here at the hairline, which is really good. And when people are doing fine with it, I come up a little bit more. And now we're up here. So let's see. With the barb 5s, I can really have a lot of leniency. I don't have to be too aggressive because they hold. A little pressure right there. Okay, so set that thread through.
So you can see at that point, he pulled out the cannula and he set the barb in place. This is a little bit different from how I do it. When I'm advancing this area, because it's very thin skin, I want to minimize the chances of seeing the thread. If it's too superficial, I see the thread. Also, we have right here running a very important area. It's the superficial temporal artery, and then we have a deep fascia here as well. So for me, what I like to do is I like to pinch the skin while I'm advancing it. The reason I pinch is because I want to put it in a deeper plane. So if it's not superficial, I hide the thread a little bit better. And then secondarily, he went vertical, so not really a big deal. But when I started going back here to pull the tail of the eye, you can see as I extend the eye, once I get back here, I want to make sure I'm under all those structures that could potentially cause a big hematoma, cause bruising and swelling, that superficial temporal artery or the vein even. I don't want to hit it. So that's why I pinch to elevate the skin and go right under it. The last part that I differ from Dr. Rajani here is you saw once he advanced it up to this point, he pulled out the cannula. For me, what I like to do is, because when you pull out the cannula, the skin already falls. What I like to do is once I insert, I hold the skin up and then I pull out the cannula. So what happens is, if you're holding the skin up into a position that you like, when you pull out the cannula, the threads haven't attached yet. So now when you release, what happens is all that skin catches onto those barbs and it holds that position a little bit better.
With what we get for a lift with a single thread, here's some lidocaine, and see what kind of pull we get.
So you can see now, because he pulled out the cannula and because that skin already dropped onto those threads, now he's really having to try to fight and massage that brow up. Whereas if I'm already holding it up, once I pull out the cannula, all those threads catch on. So whether, again, no one's right here, he's not right, I'm not right, just a little different philosophy. you can see now he's really fighting and trying to feed that skin up after the fact. So now what we'll see him do is he'll just put another barb, but let's discuss.
And just advancing it. Another way to do it is you can take the tissue and push the tissue over, and that will advance. A little bit of lido to create a space, and then a push. Can you feel it go through? It's kind of a weird, kind of a weird push. And here we are.
See how all his vectors are vertical? So when I do the cat eye, I want to lift the tail of the eye, and I'll even get closer to you. But look what happens when I just lift the tail of the eye. It just gives you more of a lifted surprise look. You also want to extend that lateral canthus right there. So look what happens when I extend. It sharpens that eye right there. Whereas I lift, I'm just affecting that brow. So when I do the cat eye, I extend, and then I lift. And that gives me that sharp tilt that you're looking for.
Here into the hairline.
So, not critiquing how he did it, but depending on the consult he had with this patient, maybe they didn't want that lateral extension. Maybe they just wanted full lift. But for me, to achieve more of that cat eye, fox eye look that people are looking for, extension and then elevation.
In view there. So what we did is lift this lateral edge of the brow. And you can, part of the way you can tell she got a really nice lift is we lost the mid-arch brow a little bit in lieu of the lateral lift. That was more.
So just looking at her, I can tell she's going to be a very difficult patient to give a full flat brow to, just because how arched she is on the side and how tall she is medially right here. So you can imagine if you're very already tall here and you have a severe slant, it's going to be hard to tilt that lateral brow to flatten it out completely. So you'll see right here in the before and or this is the after picture, you still see that she has quite the slant, and it's not that severe elevation that you see when you traditionally think of the cat eye.
Pronounced because this was down here. But we did do this tangential one which helped lift that area. Grab the mirror.
So now he jumps into one of the most important parts to me is that post-care and then having that understanding of how long these results last. Let's listen to him really quick.
It's kind of vector. And that's going to occur over the next 6 weeks to maybe 16 weeks, and then the thread dissolves. But we can, I often like to repeat things at about the 6-week mark, and then we let it be for 6 months to a year.
So with the cat eye, I'm very, very honest about that. This is why you get the very good reviews and you get the very, very bad reviews. This extreme look lasts about 2 to 4 weeks, and that's it. Because this is a very tight area. You can look, if I'm trying to lift this much, look what happens to all this skin. The only way you can get this look permanently is surgery. What we do is we overshoot to get to this point, and usually you leave the office with a little dimple here because we're trying to train the brow as aggressively as possible. After about 2 to 3 weeks, it settles and that dimpling is gone. You'll still be a more lifted and elevated position, but you'll have to come back if you want that extreme look. You come back in about a month, month and a half. We march it up again, extreme look, holds for about 2 to 4 weeks. It'll settle in more natural position again. And usually after the third time, it will tack a little bit longer, and then now your results will last anywhere from about 4 to 6 months. But it takes typically 3 sessions for us to continuously train that brow to really get it elevated. And you can see here, after 1 session, there was no way that he gave that true dramatic cat eye look. Part of it is because I don't think he held that traction up at normally what I would, but he still did a good job. The patient was pretty comfortable, and he does a good job explaining that post-procedure and when she should come back. All right, so that was a video of Dr. Rajani doing his cat eye lift. A little bit different from me. The injection method was similar. The numbing process, very, very similar. One of the big differences was I like to pinch the skin and elevate it. My vectors are different. I'm not just vertical vectors. I want to extend that eye as well. And then also when I'm pulling out the cannula, I'm holding that skin up. So when I pull out that cannula, when that skin drops, it's catching onto those threads. And then after he's cutting it, same thing. I do a little bit different and to hold that tack a little bit better when it comes to cutting. But overall, he did a great job. This is one of the reasons I idolize him. He does a great job of explaining to the patients, and the comfort and education is always on the forefront. And then the other piece, he's always learning. We're always learning here. We're always teaching. We actually have a course coming tomorrow. So if you're ever looking for trainings, we always fly to you, or you can come to us for trainings as well. So this was hopefully a cool video in regards to different providers doing different things. No provider is right, no provider is wrong, but it's really the comfort that you have with providers. Can they really explain and articulate what they're doing? And the other piece is, are they trainers? Are they educators? And then are they willing to listen to you as well? So hopefully this gives you a little bit of better understanding of the cat eye lift and how different providers do it. So I'll see you guys soon. Talk to you later. Don't forget, subscribe. Really helps the algorithm, and give it a thumbs up, and leave a whole bunch of more comments on what you guys would like to see me react to. Talk to you guys later. Bye.